Most important thing in my experience is basically if you have counseled the patient well about the expectations, about the results, then the patient will be satisfied. So if you tell him that there will be an increase in about 3 inches but you only get an increase of about 1 inch, then he will not be satisfied. So tell him realistic results so that he can expect less and will be more satisfied. Good afternoon, sir. Good afternoon. Good afternoon, everybody. I am Dr. Chirag, and I'll be talking about penis enlargement options available as of now, as we speak. There are safe and effective penis enlargement options, but it's the general awareness about these options and the safety about these procedures is not very well documented. So in my experience, these procedures are very safe, and in my limited experience of about 5 years, I have seen only one case with a complication, and that was also managed. So I would, it has already been spoken on micropenis. I will straight away get to penis enlargements. So penile augmentation, it refers to the enhancement of penis size, either length or girth or both, also called as augmentation penoplasty or augmentation phalloplasty. So how do we justify penile augmentation? Socio-cultural aspect. Across ages and in almost all countries worldwide, it has been long implied for men to have a bigger penis, which was expressed through art, literature, sculptures, or orally passed down by their family members, father or elder brothers or friends. Psychological aspect. Many patients are distressed about their penile size for a long time, making them impossible or difficult to have a normal sexual life and family social life. Most of these patients are treated conservatively by psychological counseling, but some may require some sort of intervention to overcome their mental disability. Then cosmetic counterpart for females. So men who have normal penile size who want to undergo penile augmentation may be considered on the same level with females who want to have plastic surgeries to have a pretty face or skin or bigger breasts, etc. And then there is a high medical demand in penile augmentation. Continuously increasing medical demands for this procedure due to mass media advertisements and bringing up inherent desires of men has led to an increase in demand for these procedures. Now, indications for penile augmentation would be buried penis or excessive suprapubic fat, small penis due to congenital or acquired disorders, penile shortening due to penile cancer, trauma or prostate cancer treatment or Peyronie's disease, cosmetic purposes, after thoroughly excluding any psychiatric abnormality. Patient must be counseled thoroughly about the type of procedure to be performed, including the pros and cons and expected results, post-operative complications. So most important thing in my experience is basically if you have counseled the patient well about the expectations, about the results, then the patient will be satisfied. So if you tell him that there will be an increase in about 3 inches but you only get an increase of about 1 inch, then he will not be satisfied. So tell him realistic results so that he can expect less and will be more satisfied. So these are all the types of surgical penile augmentations. Girth enhancement can be done by implantation of artificial or natural materials like cell injection, tissue graft, allograft, xenograft. Penile lengthening can be done by lipectomy or liposuction, ligament release, VY-plasty, and all these procedures. The most common procedure which I perform is basically with two things: dermograft, allograft, and fillers. So let's talk about dermofat graft, which consists of all layers of skin and subcutaneous tissues after removal of epidermis. Graft is placed between dartos and buccal fascia. The volume to be at least 20 to 30% more than the recipient size. And post-operative edema, infection, skin necrosis, seroma, graft absorption can be seen. Graft reabsorption rate is up to 20 to 30%. Increase in length and girth by both 25 and 40% post-operatively, immediately, and 20 to 10% at the end of 12 to 6 months. So this is the procedure for the, just a picture demonstration of dermofat implantation. Then autologous fat transfer, basically it involves liposuction of the fat, can be from the thighs, can be from the buttocks, can be from the suprapubic region, and then centrifugation of the harvested fat at 3000 rpm for 3 minutes. Then the middle layer is used for injection. The fat is injected into the dartos fascia, approximately 30 to 50 cc of fat is injected, and there is an increase in girth by 2 to 3 centimeters. But the main problem with this is that there are nodule formation, and also the absorption of up to 50% of the fat can occur within 3 to 6 months. In fact, in my experience, I have seen the absorption of up to 80 to 90% by the end of even 1 month or 2 months. So I don't usually do this procedure. This was one procedure which I did with autologous fat transfer. You can see the immediate post-operative improvement in the girth. Another case with the same technique. Now this is one technique which I use, which is I use it very commonly, and the results are quite appreciable. The cost, it is quite cost effective as well, and it is safe. So basically it's girth enhancement with hyaluronic acid fillers. HA filler is an ideal filling material as it is biocompatible, non-antigenic, non-pyrogenic, non-toxic, non-inflammatory, easy to use, stable after injection, non-migratory, long-lasting, reabsorbable and natural looking, and low complication rate. So it is used in cosmetic surgery in other parts of the body worldwide. Approximately 15 to 20 cc is injected between the dartos and the buccal fascia. Back and forth technique is used, and roller is used after that for evenly distributing the HA filler. Approximate increase in girth is about 2 to 4 centimeter and length by about 0.5 to 1.5 centimeters. Reabsorption by 50 to 60% at the end of 9 to 18 months. That depends on the type of fillers. So with the usual Korean fillers or Chinese fillers, the reabsorption of up to 60 to 70% can happen within 3 to 6 months. But if you use a better quality filler like Juvederm, then the reabsorption will take up to 2 years, and about 60 to 70% of it will be reabsorbed. Post-operatively, mild edema and pain formation and nodule formation can be seen. That again depends on the type of filler which we are using. With the normal HA fillers, Korean fillers or Chinese fillers, the nodule formation chances are more. With Juvederm, which is a more finer HA filler, the chances of nodule formation are very less. So this is Juvederm Voluma, and that is the Korean filler. The cost of Juvederm filler is about 40 to 45,000 per 2 cc. So the overall cost for the procedure goes up to 4 to 5 lakhs, so which becomes unaffordable for many patients. But at the same time, there is another filler called as Mesoheal. It's from a Korean company again. This is relatively cheaper. The results are quite similar to Juvederm, but there are chances of nodule formation in this. And it lasts for about 1 year to 15 months. These are before and after pictures of some of the cases which I have done. You can see there is an immediate post-operative improvement. I don't have pictures after 3 months or 6 months, but as the patients report back, they say that there hasn't been much change in 6 months. With the Korean fillers, they start seeing changes in the girth after about 9 months. But with the Juvederm, they can see the same results for up to 1 to 1.5 years. So the most important thing is counseling the patient and telling the patient what exactly the outcome is going to be. So if you tell him that there'll be an increase of about 1 inch, you will be able to achieve that, and then that will be satisfying for the patient. If you tell him there'll be an increase of 2 inches, he gets about 1 inch increase, he will tell you that you said 2 inches and it's only 1 inches. So the most important in counseling, satisfaction of the surgery will come only with good counseling. Now another method which I commonly use is allograft. It is an acellular dermal matrix. It's available in sheets of different thicknesses. It is acquired from donated skin using proprietary processing techniques which preserve the biochemical and structural components of the extracellular matrix. ADM is used in burn wounds, reconstructive surgeries, abdominal hernia repair. There are many in the market, but the most commonly and most popular ones are megaderm, alloderm, shorderm. Megaderm is from Korea, alloderm and shorderm, they are both from the United States. No donor site scarring, good graft survival and low complication. Pinopubic incision is the one which I routinely use, although you can also use a circumcoronal incision. And the graft is placed between the dartos and the buccal fascia. There is always a risk of post-operative infection and swelling, skin necrosis, fibrosis. I have seen in my practice only one case of skin necrosis that was managed conservatively with some dressings. Average girth increase is 2 to 3 centimeters and length also by 2 to 3 centimeters. This is how it looks like, allograft, and it's available in various sizes, various thicknesses. So this was a patient, he came to me with relatively small size penis. His testosterone, he was trophic hypogonadism. So I gave him testosterone replacement therapy for 6 months. The size increased. He wanted a further increase in size, and so I did a dermal graft for him, and that is the result after that. This is another case with allograft. Another case with allograft. This was a patient from Africa, and he already had a very long penis, but he wanted increase in girth. So I had to place 2 grafts back to back, and that resulted in this post-operative. These are all post-operative before and after pictures of penis enlargement. So if you can see the incision in the pinopubic region, that is a small incision which we give, and we evert out the penis and then wrap the graft around the penile shaft to cover it dorsally and laterally, but not ventrally. Now this is a very new technique, and I am using this since last 1 year, and quite a few cases I have done, and by far this is the best filler or best material for penile enhancement. So PLA filler is basically poly DL lactide, polygalactic acid, and it is made from PDLLA, a biocompatible and a biodegradable substance. It naturally stimulates the skin to produce collagen. It works to enlarge penis, buttocks, replace lost collagen in human body with results lasting up to 2 years. So the results of this filler are longer lasting than HA fillers. It's much more finer in texture. So the chances of lump formation are very less in this. So why PLA filler? Immediate efficiency, safe, rapid, convenient, no rehabilitation needed, versatile, and no preparation preparation needed for the filler. So this is a brand which I use, Powerfill. This is the only brand which is available in the world which makes this filler. This is specially for a micro penis. Then the mechanism has been explained, but the image was vertical, so I had to put it horizontally. So this is, it's just It comes in powdered form, and you mix it with saline and then shake it for about 20 minutes and then inject it between the dartos and the buccal fascia in all the planes, in all the directions except the ventral aspect, and you see a very homogeneous and uniform appearance of the penis post surgery. These are few patients which I have done recently. Patient can resume sexual activity after 1 week, and if there is any lump formation or nodule formation, you can inject Hyalase injection into the lump, and that will dissolve the lump within 2 to 3 days. Then there is another technique of girth enhancement with silicone, which is an obsolete technique now, but many places people are still doing that, but there are a lot of chances of skin necrosis and infection. So I don't routinely use this technique. Now lengthening techniques are quite limited. Most commonly used technique is division of suspensory ligament with post-operative penile traction. Suprapubic incision, it does not actually lengthen the penis but appears to be longer by 1.5 to 2 centimeters. Penile instability during erection can occur if more than the ligament is divided. Not practically seen in cases, but theoretically there is a risk of instability. Can be combined with Z-plasty or VY-plasty. A buffer has to be placed so that to avoid the reattachment of the ligaments with the bone. So, well, according to my experience, the length enhancement is very difficult to achieve. And it's very difficult to convince the patient that he has actually achieved some length, because in actual reality the length doesn't increase, it just appears to increase. So the results are not very satisfactory, and so I have stopped doing this procedure since some time, because I was not very happy with the results. So I stopped doing it. So now I mainly counsel the patients for, if they want an enlarged penis, so that the girth is the only thing which they can safely and effectively achieve. Then there is something called as penile disassembly, which is done in Serbia by the Perovic Foundation, but they have also discontinued it because it's a very very intense procedure, a highly invasive procedure, and there is always a risk of damage to the neurovascular bundle. Then there is this FDA approved endopenis device, which they claim that the length can increase by 3 to 4 centimeter and girth can increase by 1.5 to 2 centimeters. That's it. Thank you. Any questions? Yes, sir.
You are told that it lasts for 2 years.
Yes, sir.
So in a lifetime, how many times he has to get it?
As many times as he wants, sir. As many times.
But
as he or she wants.
As a surgeon, we know that there is some kind of fibrosis as well whenever we do any procedure. So
with this hyaluronic acid and PLA fillers, they induce very minimal reaction, sir.
Okay.
So there is very, very less chance of fibrosis.
What is the maximum time you have done the procedure in a particular patient?
Maximum. So the first procedure which I did.
No.
So that
in a single patient, how many times you repeated?
3 times.
That's good.
Yeah.
Good.
So that patient, first he took the device, he was not satisfied. Then he went for fat, he was not satisfied. Then he went for the HA filler, he was satisfied. He came back again. We did a hyaluronic acid filler. Then again I did HA filler, another brand. Then again he came, he said, I want something better than this, which can last for a longer time. Then I did a PLA filler, and now he is currently managed on PLA filler, so he is pretty happy with the result.
He has done good window shopping.
Yeah, good. Yes. It's just by experience. You cannot confirm it.
You just pierce by giving injections, so it is very difficult.
It's difficult. It's difficult. So it's just
by do by ultrasound or
no. I don't use any radiological modality.
And the secondary, the division of this suspensory ligament is long-standing effect. So theoretically,
No, I haven't seen any complications, but the results are not very satisfactory. I mean, out of 10 patients, 5 or 6 would be satisfied, but the other won't be satisfied. But that also depends on how you counsel them. You have to tell them that, there won't be an actual increase in the size. It'll just appear to be longer in the flaccid state. Erect length will not be affected. But with the fillers and the graft, the erect length will also, erect girth will also increase, the flaccid girth will also increase.
but you have to repeat now all these procedures other than the ligament division. That is one-time procedure and other.
Ligament division.
Yeah.
It's a one-time procedure, but the ligaments can reunite. But the results are not very satisfactory. So I usually do not encourage patients to go for this kind of treatment.
Yeah, Dr. Chirag.
Yeah.
Any extra precautions patient has to follow while having intercourse after these fillers or anything?
No. So he can resume sexual activity after 1 to 2 weeks.
No extra precautions. These allograft
Just
doesn't
one
get-
thing he has to keep in mind: for the next 48 hours, post-operatively, he has to keep his penis erect. Erect as in upright.
upright position.
Upright.
There is
With a
no
tight underwear.
chances of displacement of this allograft.
No, because you suture it to the tunica or the bucks fascia, sorry.
Okay. And the question the patient asked whether can partner knows about this allograft, and is there any difference in feeling?
Feeling is there, yes, it's there. So with the allograft, there will be a different feeling of the whole penis. It'll feel much more firmer.
So is it acceptable to the patient that
Yeah, we tell the patient that, this is how it will feel. This will be different from what it is now.
artificial, it doesn't feel like an artificial penis or something like, because patient says that
Yeah,
sir, if it's-
but that's what I'm saying. So counseling is important. You tell everything, whatever is going to happen, you tell that to the patient. Only if he accepts everything, then go for the procedure. If he says that he doesn't want that artificial feel, then tell him go for something else. Then go for fillers or PLA fillers or fat or something.
Okay.
Hello.
But the cost for this PLA fillers?
Yes, sir. Sorry?
Cost for the PLA fillers
Approximately 1.5 lakhs.
per sitting.
Yeah.
Do you have any experience with PRP? Excuse me?
Sorry.
Here.
Yeah.
What about PRP?
Nah.
Do you have any experience?
I have a lot of experience. I have done quite a few cases of PRP, P-shots in Peyronie's and ED. But for penis enlargement, it doesn't work.
Doesn't work.
It'll give you fullness, but that also depends on some patients only, not for all the patients.
That will not last long?
No.
No. Okay, thank you.
Results last about 3 to 6 months with
Okay,
PRP.
thank you.
Excuse me, sir. Sir, if the patient is coming with for penile enlargement and both girth increasing, so do you combine this procedure of cutting the suspensory ligament and then using the fillers, or either or procedures you prefer?
We can do both the two things together.
Okay, so this has a better result, or?
I don't usually do the suspensory ligament division now. I had done it before, but I wasn't happy with the results, so I stopped doing it now.
Okay, sir. Yeah.
now some andrologists are also doing penile implant for lengthening.
Well, that is a totally different thing. Penile implant is basically you are implanting the implant into the corpora cavernosa. So that will result in a little bit of increase in the length, because it won't be in the flaccid state as it is without the implant.
Okay, thank you,
With the
sir.
implant, it will be in a semi-erect state. So he will have a perceived notion of improvement in the length.
Yeah, thank you. We can carry
you.
discussion little
Thank you,
later.
thank you, thank you,
Yeah.
thank you.
I invite Dr. Vijapan sir to felicitate Dr. Chirag Bhandari sir.